Hey everybody, it's me. It's May 3rd. I'm sorry. I don't know why it is, but this last few days, I just can't seem to get it right. I keep thinking it's a day before, so whatever. I just wanted to touch base with everyone. Today was day 2 of radiation. I couldn't do any videoing in the unit because I was not feeling well, and I thought if I spoke I would probably puke. It was that bad. I'm not sure if it was something I ate last night, like dinner. I did a stir fry. Maybe it just didn't agree with me. I don't know. It could have been anxiety, but I have never experienced anxiety to the point where I was literally nauseous. I felt like I was gonna, like, oh God, I might be sick, but not that whole nauseous, like feel sick to your stomach, constantly feeling. So I don't like that. Don't like it at all. Nobody does, but I really don't. Oh, I have a bit of circles under my eyes today. Oh, I just see that in there. Sorry, you can tell how often I actually look at myself in the mirror. Not very much, or else I wouldn't have. Anyway, whatever. It is what it is, right? So I went to my appointment. I left work early. Felt sick all day long. It was the weirdest thing ever. I woke up this morning and I felt okay. I had some coffee and I started to get ready for work, and then I started to feel sick to my stomach. I'd gone to the bathroom. I'm sorry, this is very vivid, but everything seemed to be not bad. What you would expect after eating a whole bunch of vegetables the night before. Anyway, I was like, just my stomach felt off, and I was going to take my medicine and I couldn't. I thought if I put anything into my mouth or like drink of water or I would vomit. It was really pretty intense. Not a watery feeling in the mouth, just a sick feeling in my stomach. It was weird. So, excuse me. So I showered, I got dressed, I went to work, and on the bus I had a lot of anxiety. A lot. And there's a girl, thankfully, that takes the bus with me. And I'm really glad she was there today because she brought a lot of sense of calm to me. Because she rides the first bus from where we live to the station, and then she goes downtown as well. So it's nice we take the same buses all the way through. And dealing with anxiety, she brings me comfort because I know her, I can talk to her, I can babble on. She's a really cool person. And she's very non-judgmental and very accepting. She knows what's going on. And I actually kind of feel safer when she's around me. Maybe because if something were to happen, she knows what's going on. She could tell whoever, yes, this is happening to this lady. Anyway, she's cool. I like her. I have her on my Facebook. I won't say her name because I think she's a bit shy. And I don't want to really call her out or anything because that just isn't inappropriate without asking. Anyway, so I went to work and I trained the new girl who is actually the old girl who worked for us. That sounded terrible. The new person that's working for us is actually a past employee. There, that's better. She worked for us in the summertime for 6 months, and she left to go on to bigger and better things. And anyway, she was available. We asked her and she came back, which is fantastic because she knows the system. She knows how the construction site works and the whole bit. And it's an easier transition for me. I only have to show her a few other things and we should be good. Excuse me. She also has the option of phoning me when I'm off. Oh, gosh. Excuse me. She has the option of phoning me when I'm off, too, because I would never leave anybody in the lurch. And it's been a pretty quick, hey, I got to leave work in like a week and a half, and wow. Anyway, I wouldn't do that to anyone because it's just not me. Anyway, I'm doing that a lot since radiation. It's just like all the inflammation and stuff going into my my voice box. So anyway, getting back to this, I left work. And the weird thing is today is that I would have waves of nausea. So I would like get really hungry and I would have a little bit to eat, like a couple spoonfuls of yogurt or a bite of a granola bar or half of my peanut butter sandwich or a quarter of it actually, and then half. And then I would feel sick. And then a couple hours later, I'd be really hungry. And then I'd feel sick. So I was like, oh man. So I left work. I wasn't feeling great. I went down to the bus and I was like, thank God it was a little bit earlier because then the rush hour hasn't happened yet. All the people rushing, like normally the people that I take the bus with, it's jam-packed. Because when I'm under anxiety and I feel sick to my stomach, that doesn't go well with me. I would prefer to actually physically walk the 1.5 to 2 hour walk home than to take the bus. Anxiety is very powerful, and anyway, that's the way it is. So I excuse me, I'm so sorry. So I got on the bus. I phoned Rich because it was like I needed that cushion. I needed to talk to someone to get my mind off everything while I take the bus home. When I'm under anxiety on the bus, like I said, it's quite powerful for me. It totally almost consumes me. And it's just the fight or flight, and I always want to fight. I'm a fighter, but when it comes to my anxiety and stuff like that, if I can get off the bus and stand on the side of the road, as soon as I get off the bus, I feel better. So today I couldn't because I had to come home, grab the car, and go to the hospital to get my treatment. So I'm on a timeline, and I don't have time for anxiety and the stupid way that I have to deal with it. So I phone Rich. That's the other outlet I have, is that I will phone someone and I'll just talk to them for the 20 minutes I'm on the bus. I make no sense. I talk about nothing that has anything to do with anything. I just babble on to get my mind to redirect it somewhere else, my attention somewhere else. So talk to him, thank God. Well, when I'm in the middle of talking to him, the hospital phones. I'm like, oh God, what now? So last Thursday, I was admitted to the hospital. I had a stay, and I went home on Friday. Well, they wanted to phone and do a customer service survey. A nurse phoned me for a customer service survey to see how my stay was and if it was nice and pleasant, and was there anything that I think that they could change. I had this last time when I had my major surgery for my hysterectomy, and it was like they're like a 5-star resort and they want your feedback. So I gave her my feedback, that my nurses were excellent. The one lady in the evening, Rebecca, was fantastic. When I came up on the floor, she actually stood there with her arms wide open saying, welcome to my floor. You're my patient and I will take care of you. And I was just like, wow. And but of course I was sleeping and stuff, so I didn't get to see her too much. And Ian, her, I keep wanting to say fellowship, but her intern, her student nurse. I'm so used to fellowship, interns, residents, and student nurses. I get them all combined because, anyway, it's a teaching hospital, which is good. That's my cough now, which isn't too bad, right? Yeah, I just have some inflammation in here, which causes a little bit of wheezing and that little bit of a cough, which is, wow, way so much better than it was before, right? When that stupid stent was in there and I sounded like freaking Darth Vader. It's like, now listen, I'm pushing that, but when I breathe in, you can hear a slight wheeze. Little wheeze. Sorry, I have to look up a little wheeze. So anywho, I tell them about the nurse in the morning and how fantastic she is. Her name is Marie Eve. And she is the person that reminded me of my childhood friend, Lita, from back home in Kincardine. She had the same mannerisms. She had this caring way about her that Lita always had growing up, and then when we became young adults and stuff. And the way Lita is now has this big heart, this big, beautiful, kind heart. And this girl was just very comforting because it was like Lita, but just looked a little different. And she was French and Lita is Dutch. And that's neither here nor there. It was just really like, so anyway, when they were talking to me today, I had to say to how this young girl, she's probably maybe 28 or 30, maybe, how fantastic she was. Like, phenomenal. She was a phenomenal nurse. For someone that young to have the amount of caring and compassion for her job was just like astounding. I see that in a lot of the older nurses or the nurses who've been practicing for quite a while. But I hate to say, but a lot of the younger nurses, not all of them, but I have come across a few who shouldn't be in that profession. I've come across some of the older ones too, but not very often. But there's some that I have come in contact with that you think, wow, why? This woman, this girl, was not like that. She was, like I said, phenomenal. There's a lady across the room, older lady, a little bit confusion and had to speak a little bit louder. You had to tell her a few times so she kind of grasped it. And this nurse was so fantastic with her, like the patience that she had with her, pardon the pun. But it was incredible. Never, like, she'd repeat herself 4 or 5 times and you never heard any frustration in her voice. She would joke around with her, and it was just this girl so totally picked the right profession. It hand in glove, man. So this is what I told this surveyed nurse today, and I couldn't say enough nice things about this Marie Eve lady, girl. Fantastic. So, and I said, like, I was going to write a letter to the hospital, but where do I write it? So she said I didn't have to do that, they're recording me on the phone or something, and she's writing it down too and whatever, but she's going to make sure that the head nurse for this girl will get this, and this girl will get what I have said about her. And I was like, great, because she deserves it. I believe that when someone does a really fantastic job, it doesn't have to be towards me. If it's towards somebody else, the people need to know that, because it's important. We always get crapped on, and everybody hears about all the crap, but you never hear about all the great stuff. So I'm one who gives the great stuff when it needs to be given. So anyway, that was that. So I get off the bus and I phone Rich back, and I'm actually feeling fantastic. I don't feel sick. I have no anxiety. I'm like, oh my God, it's gone. What the heck? I don't know. Maybe it was something to do with work. Who knows? I get on the bus, boom, right back again. So I'm like going, what the heck is going on with me? This is really like up and down, up and down. I feel like I'm like going crazy. So I get home and I feel crap. Oh my God, I feel crappy. And I take my medication and I'm thinking, please work. Please work. It's CBD oil. And I've been taking that since Saturday. And it's helped with my anxiety quite a bit. I couldn't take it this morning because I thought I was going to, I really thought I was going to puke. So I take it because it's supposed to help calm your stomach, which I found out, which I didn't realize. I thought, the heck with it, I'll take it. So I take it. I go off to my appointment. I'm starting to feel not too bad. So I get to the appointment. I talk to the technicians. They always ask you, how are you feeling? Any new symptoms? Blah, blah, blah. So I tell them about this whole nausea thing and about the pain in my back, and it feels like someone's punched through right at the back of your shoulder blade, just underneath it. Excuse me. Punch right through here. See, this is where sorry, I'm not trying to show you my boob. I'm trying to show you, okay, this X, that's to line up the machine every day on me. That isn't where the radiation comes through. The radiation actually comes through at an angle this way. Poof. Oh, sorry. Try and do it with this hand, but I don't think I can. So, and I don't want to show you my whole boob. So the radiation kind of comes in an angle. Oh, you can't see it, damn it. Anyway, comes in an angle like this, but it's on the other side, down here. So it comes in like this way. Oh, frig. Comes at an angle like this. I'm trying to do it. I can't. Anyway, comes in an angle like this. No, it's not working. Anyway, it comes in an angle. Almost like not a 90-degree angle, but whatever. Like an angle like this. Comes in across and goes right into here. So right here, so I think the beam comes in here, but it's on that angle. Oh, I can't do it, the angle. It's on an angle like this, so it goes in here. My tumor is in here. So right here is where the stent was, and I know that because that's where I felt it. When they put it in, I felt it. And I had the exact same kind of pain in my back, under my shoulder blade, that I had when the stent was in as I did yesterday or today. So I'm thinking, I know exactly where this tumor is. I can feel it. So that's where the radiation comes through. So that's where, right in behind this, right in here on the other side, and it's right underneath your shoulder blade. It's kind of like, I'm sitting here like this over here, but you can't see, right? Yeah. So I'm sorry. I'm thinking the screen is like ginormously large. It's not. So I have to try and do this. It doesn't work very well. So your spine is here, right? And then, I need both hands. Okay. So on either side of the spine, on either side of your spine, right? So the pain I'm getting is my spine is here. And then on the other side of, it's not making any sense. Sorry. Anyway, it's in between the spine and the shoulder blade is where I feel it. But it's just on the very bottom of my shoulder blade, just on the very nick. Like when your shoulder blade comes down, it goes like this. Well, like here, like this. It's like right there. And it's almost like it's halfway underneath the shoulder blade and outside of it. Sorry, I'm tired, so I'm talking a lot to describe. Because I don't think you get it. And you probably already stopped listening to me. Anyway, so right there, it feels like someone's punched me right in the back, and it's come right through this part right here. And the hand is like outside of it and hanging on. My lung is hanging outside here, dangling. It like is painful. So, and all the muscles in my whole, like on the right side, right down into almost not quite into my buttocks or my hip, but pretty close. They're all like super tight like this. It feels like I've been out lifting, like, and not kidding you, 400-pound weights. Not that I could ever lift 400-pound weights, but that kind of gives you the extreme of the tightness of your muscles. They're like not moving. I'm not allowed to use Advil. I can use Tylenol for pain, but for inflammation, I'm kind of screwed. No, I could go on the prednisone again, but no thanks. It's not that bad. I don't want to do that because my blood sugars shoot up to like 26. Are you kidding me? God, I feel like I'm having an earthquake inside. I feel like my whole body's like shaking on the inside. So no thanks. So I can't take Advil. I can take Tylenol. I can't put any heat on it. So, or any kind of liniment or anything like that. I can put Lubriderm on it, but that's not going to do anything. That's just for dry skin. So to combat this, there's nothing really I can do. I've been